Hello everyone, welcome to GrowMed. Welcome back to another session where we are discussing 10 most important topics from each subject. And today we will be discussing about the microbiology, and already I have uploaded the videos on the various other subjects. So do watch those videos. The link will be given in the description box. So watch those videos to boost your preparation, and you can expect 5 to 6 questions from each of those videos. It will be helpful for you all in your last minute revision, as in very short time we can cover a lot of topics. So let's start our discussion. The most important topic from the micro is the dermatophytes, and this dermatophytes is asked in integration with the dermatology also, because these causes skin manifestations, right? So it is used in integration with the dermatology. So it is classified into the three types. The first one, the trichophyton, then epidermophyton, and the microsporum. So you need to imprint these images in your brain, because image based question can be asked on it. And we'll look at the things which are asked in this based on the dermatophytes. So questions are asked on the infection which it causes and the organs which it involves. So the trichophyton, as you can see here in the image, it gives a pencil shape appearance, and it involves the skin, hair and nail. तो तीनों चीज इन्वॉल्व करती है ट्राइकोफाइटोन, एंड यू कैन रिमेंबर इट बाय द नेम tri. So tri hair, so skin, nail and hair, all the three things will be involved. Then for the epidermophyton, it is the club or the boot shaped, and it will be involving the skin and the nail. So epidermo means involving the skin. तो यहाँ पर you can easily come to know कि epidermo skin is involved, and along with the skin the nail will be involved, because nail is in touch with the skin. So as you can remember it, the epidermophyton. Then the microsporum, so it is a spindle or the fusiform shape. So you can see here, तो ये spindle shape का दिखता है, and it involves the skin and the hair. So this is about the dermatophytes, which you must remember. Then moving on to chromoblastomycosis, a repeat topic asked multiple times. So this is the image which you need to remember, because image based question can be asked on this. So image दे देंगे and they'll describe various things and they'll ask the diagnosis. So this condition causes warts in the skin. That's why it is called as the verrucous dermatitis. तो skin warts ये cause करता है, and this image, these are the sclerotic bodies or the copper penny bodies. These are the brown color bodies which are seen on the biopsy. तो स्किन की बायोप्सी जब हम लेंगे ना, लीजन की बायोप्सी लेंगे और हम देखेंगे, तो वी कैन फाइंड दीज थिंग्स. Then most commonly seen in the forest worker. So if at all a clinical case is described, then these things will be described like the forest worker. Then dermatitis or warts are seen, and this image they can give, or they can just explain that copper penny bodies or the sclerotic bodies. And if at all brown color B, if they are describing in the question, then you can go with the chromoblastomycosis, because the name itself says chromo, black color, brown color, and chromoblastomycosis is the fungal. ठीक है, तो I have already uploaded a complete video on the mycology. तो microbiology में जितने भी mycological conditions है and the fungi causing the diseases, along with their images and appearance, I have uploaded. So watch that video also, because उसमें मैंने बहुत सारी important चीज़ें cover की हुई है, like the aspergillus, the mucormycosis, then the dimorphic fungi, the sporothrix, all those things. So you must watch that video also. Then moving on to food poisoning. So you can expect a question from this food poisoning in the upcoming exam, because in every paper this question is being asked. So there are 5 organisms which will be causing. So we, based on the type of the food involved and based on the incubation period, we can easily classify these things. So the staph aureus most commonly involved, and सबसे ज़्यादा commonest food poisoning caused by the staph aureus. Incubation period will be 1 to 6 hours and more mainly associated with the milk products or the poultry product. So in case they will describe that in a party there are various children and they had a pastry. तो pastry खाने के बाद में बहुत सारे बच्चों की vomiting होने लगी and they started having food poisoning. तो what will be the cause? So it will be the staph aureus. And if in case if they've described the Chinese food like fried rice या फिर noodles, then go with the B series, because it will be causing the food poisoning in case of Chinese food. Then Clostridium botulinum, so it is canned food and enterotoxin है जो cause करता है ये food poisoning, and ये mostly canned food में देखने को मिलता है, like the foods which are processed and packed. तो उनमें ये देखने को मिलता है क्लोस्ट्रीडियम बोtulinum. Then another important is the Clostridium perfringens. The incubation period 8 to 24 hours and contaminated meat or properly uncooked meat. तो वो खाने की वजह से if a patient will be having food poisoning, then think in terms of the Clostridium perfringens. And this was a PYQ asked that seafood खाने के बाद में patient को food poisoning हो गया तो what will be the cause? So it was the Vibrio parahemolyticus. ऐसे करके तो फूड पॉइजनिंग इतना याद कर लो. दिस वन इज मोर देन इनफ आई थिंक, क्योंकि क्वेश्चंस इसी पे ही पूछे गए. दे आर ऑलवेज रोमिंग अराउंड दीज थिंग्स ओनली फ्रॉम द फूड पॉइजनिंग. Moving on to Corynebacterium diphtheria, a repeat topic asked multiple times. तो ये एक bacilli है. It is a bacteria and so this is also called as the Klebsiella bacilli, and you need to remember this name because they can interchange the name. Instead of diphtheria they can ask this bacilli to confuse you. So it is a non-sporing, non-motile and non-capsulated, and Chinese letter pattern is seen, also called as a cuneiform arrangement. So this one is the image and this is how the bacilli looks. So image based question can be asked, so you need to remember this image. And granules, the granules of this diphtheria, they are metachromatic. Then polymetaphosphate, Wallin and Babes Ernest granules are seen. Then stains, so this one is important, and the stains used for this are the Ponders, Albert and the Nielsen stain, and all these three stains will be staining the diphtheria green color. Clinical features seen are the pseudomembrane, which is the most common seen in the tonsillar region, and there will be history given that the whitish patch or membrane seen on the tonsils which bleed on touch. So this one is a pseudomembrane. It is not a perfect membrane because if it was a membrane, true membrane, then it would not come when we will remove it. So this pseudomembrane, when we will remove it, it will start bleeding, and if it was a true membrane, then it would be attached so tightly that even after pulling it we will not be able to see it. Okay, so there are various conditions in which we can see this white membrane, like the Vincent angina, then the infectious mononucleosis, then acute membranous tonsillitis. So there are various other causes also. And the another important presentation is the bull's neck. That means the neck will be swelled so much, and image based question have been given on this bull's neck. So these are the things which you must remember from the Corynebacterium. And this one is the image. So you can see here the image, a whitish membrane seen on the cornea. So remember this image, and if at all this image is seen and these things are described in the question and in the options, if diphtheria is there, then mark the answer as the diphtheria. Then the lab diagnosis. So this was a PYQ asked that for diphtheria toxin, which test is done. So it is the LX gel precipitate test we will be using for the demonstration of the toxin. Then other two media used for this are the Loeffler serum slope, and for the selective it will be the potassium telluride agar. So you need to remember these things also. Then moving on to the next topic, Bacillus anthracis. So this one is also a repeat topic, and questions have been asked on this frequently. So we will look at the questions which are asked. So the virulence factors are the capsule and the toxin. तो capsule में जो polypeptide present है वो that one will be acting as a virulent factor, and the toxin triparatide toxin will be acting as a virulence factor. Then moving on to the types. So it is present in three types: cutaneous, pulmonary and intestine. तो जो cutaneous है means it will be causing the skin manifestation. तो मतलब by the name itself you can get an idea. तो skin will be involved, and what it will be causing in the skin is the malignant pustule, mainly on the neck region. This is also called as the Hyde-Potter's disease, and ये usually पता है question if they told they give a केस, then they'll be describing that sheep trader या फिर कोई भी जो है फॉरेस्ट वर्कर या फिर फार्मर, कोई भी मतलब एनिमल्स के टच में रहेगा, एंड उन पेशेंट्स में दिस मैलिग्नेंट पुस्ट्यूल कैन बी सीन मेनली ऑन द नेक एरिया. तो दैट्स वाई दिस इज कॉल्ड एज द Hyde-Potter's disease. Then moving on to the pulmonary, so this is called as the Wool-Soter's disease, and it will be causing pneumonia. And how will prevent it? By doing the dirking. Then another important PYQ asked is that this pneumonia जो भी स्पीशीज ये निमोनिया कॉज करता है, जो पल्मोनरी मैनिफेस्टेशंस कॉज करता है, दैट वन इज अ बायोटेररिज्म एजेंट एंड इट इज़ अ कैटेगरी ए बायोटेररिज्म एजेंट. तो यू कैन रिमेंबर दैट ए से एंथ्रासिस, ए से कैटेगरी ए, एंड दिस बी से बायोटेररिज्म, तो बायोटेररिज्म करके ऐसे यू कैन रिमेंबर इट. देन द ग्राम स्टेनिंग, तो ऑन वेरियस अपीयरेंसेस, मतलब दूसरे दूसरे कल्चर मीडिया पे, फिर वेरियस टेस्ट पे, दिस विल बी गिविंग अ डिफरेंट अपीयरेंस. तो ग्राम स्टेनिंग पे इट विल लुक लाइक अ बैम्बू स्टिक और अ बॉक्स कार. Let me show you the image. So this one is the image of the Bacillus anthracis. तो you can see here, मतलब बॉक्स टाइप की अपीयरेंस आपको दिख रही है यहाँ पर. देन agar में it will be giving a medusa head appearance. So this one is the medusa head appearance. मतलब कि एक medusa जो था वो एक ग्रीक माइथोलॉजिकल क्या बोलते हैं, गुरु टाइप का था, एक ग्रीक माइथोलॉजिकल क्रीचर था, जिसमें दिस वन इज द फेस एंड यहाँ पर से पूरे देयर वर स्नेक्स अटैच्ड. तो ऐसे टाइप की अपीयरेंस हमको देखने को मिलती है. दिस वन इज द फेस एंड दीज आर द थिंग्स अटैच्ड ऑन द हेड. तो इसीलिए दिस वन इज कॉल्ड एज अ मेड्यूसा हेड अपीयरेंस. देन gelatin liquefactions, इस टेस्ट में it will give a inverted fir tree appearance. तो you can see here the inverted fir tree appearance टाइप की फीचर दिखने को मिलती है. and on the penicillin agar we can see string of pearl appearance. so this one is the penicillin agar and you can see the मतलब pearls of sting ऐसे ऐसे करके. so this is the classical image seen with this Bacillus anthracis. Then selective media is the PLET and it shows a McFadden reaction for the capsule. So these are the important things which you must remember from this Bacillus anthracis. Then moving on to some basic things from the general micro, that genetic transfer. So transfer of the genetic material from one bacteria to the other bacteria and occurs via three methods. First one is the transduction, occurs via bacteriophage asked multiple times. So we all know that bacteriophage ऐसा करके रहता है and इसमें genetic material रहती है. So this one is a famous question asked. One liner के तौर पे पूछा गया. image based questions have been asked, so you need to remember this one. Then transformation, तो free DNA taken from the environment. Then conjugation is via a formation of a bridge. मतलब कि this is a cell and this is a cell. So this between the two bacteria there will be formation of a bridge and वहाँ से वो genetic material transfer होती है. and usually this one is seen in the plasmid factor. तो मतलब plasmid factor करके एक रहता है, तो वो जो है conjugation के method से transfer होता है. देन बैक्टीरियल ग्रोथ कर्व्स, वेरी इंपॉर्टेंट एंड वेरी बेसिक थिंग. तो माइक्रोबायोलॉजी में सबसे पहले वी विल बी रीडिंग अबाउट दिस कर्व ओनली. तो इट हैज़ 4 stages. फर्स्ट वन द लैग फेज, द लॉग फेज, स्टेशनरी फेज एंड द डिक्लाइन phase or the death phase. So in the first phase what happens is that cell adaptation will be happening and increase in the size, enzymes and the metabolites. मतलब कि जो बैक्टीरिया की साइज है वो बढ़ती जाएगी इस लैग फेज में. This next phase is the log phase, which is also called as an exponential phase. And what happens is that increase in the number, sorry size नहीं है ये, increase in the number of the bacteria, मतलब कि bacteria will start to divide. तो divide होने लगता है, तो इसीलिए number increase होने लगता है. And in the stationary phase we can see toxin and sporulation. So sporulation and toxin both were asked as a one liner in the past years. And डिक्लाइन फेस में डेथ होने लगती है बैक्टीरिया की. सो द स्लोप विल बी कमिंग डाउन. सो यू नीड टू रिमेंबर दिस, क्योंकि इमेज बेस्ड क्वेश्चन भी दे सकते हैं. दे कैन आस्क गिव दिस ग्राफ लाइक दिस एंड कोई भी एक चीज़ मार्क कर देंगे एंड दे विल आस्क यू टू आइडेंटिफाई इट. देन मूविंग ऑन टू द क्रिप्टोकोकस. तो क्रिप्टोकोकस भी बहुत ज़्यादा इंपॉर्टेंट है. एंड यू जो फेमस क्वेश्चन पूछा गया है ना दिस क्रिप्टोकोकस पे, इट इज़ अ केस एंड आस्क्ड इन इंटीग्रेशन विद द मेडिसिन. तो ये क्या कॉज करता है, मेनिंजाइटिस कॉज करता है. तो मेनिंजाइटिस के साथ साथ दे विल बी डिस्क्राइबिंग फीचर्स लाइक HIV पेशेंट एंड इंडिया इंक पॉजिटिविटी कर देंगे या फिर कैप्सुलेटेड ऑर्गेनिज्म करके दे विल बी डिस्क्राइबिंग इट. तो वेरी वेरी फेमस क्वेश्चन है. एंड इफ़ इट ऑल यू हैव सॉल्व द PYQs, तो यू विल बी एबल टू रिकॉल दैट ये आपने सॉल्व करा होगा पहले कभी. तो देन इट इज़ अ ट्रूइस्ट. most commonly associated with the HIV positive. So we have discussed HIV positive, then it causes meningitis. India ink staining is used and it shows this appearance on the India ink because it is a capsulated organism. Then blood and CSF pay on the subagar dextrose agar, it will be giving a smooth mucoid creamy colony like this one. So you can appreciate that there are creamy colonies seen. Then for the antigen, we will be using the latex card agglutination test, and drug of choice is the LAMB, which is the liposomal amphotericin B. So if at all these things are described in the case HIV patient meningitis India ink positive, then straight away go with the Cryptococcus, and if at all images दे देंगे then it will be a piece of a cake, मतलब कि examiner खुद आपको उसका आंसर बता रहा है. Then moving on to the parasite egg. So parasite eggs are also important and image based questions are asked mainly on this parasite eggs. So we will look at the images and also some important things which are related to each of the egg. So the H nana, this is the egg of the H nana, and you can appreciate that it has hooks here present like this, and near the hooks there's a thickening called as a polar thickening, and opposite to it polar filaments. So if at all image based question they denge and in that image you will be able to appreciate these things, then go with the nana. So for drug of choice for this nana, H nana, is the praziquantel. Then moving on to the ascaris. तो ascaris के जो eggs है there are of two types, fertilized and unfertilized. तो unfertilized eggs जो है वो female में देखने को मिलता है, and this fertilized egg it is associated with the intussusception. तो clinical features रहेंगी intussusception की like colicky abdominal pain, then the things which I will be describing this intussusception. ठीक है, तो ascaris these are the eggs. Then D latum egg. तो this egg, the characteristic feature is that it is having a lid. तो यहाँ पर you can appreciate that like this a lid करके है, and this egg is called as an operculated egg. It is associated with the megaloblastic anemia. So the lid and the operculated egg, this is the characteristic feature. Then moving on to the schistosomiasis. तो 3 टाइप की eggs है और 3 species है अलग अलग. तो first one schistosomiasis mansoni. So it will be having a lateral spine. तो image based question में to identify it as a mansoni you need to look at the spine. तो ये laterally present रहेगा. Then it will cause the Katayama fever and swimmer's itch. तो invades skin directly. So this was a PYQ. I do not remember exactly किस साल में पूछा गया था. I think this was asked in Jan 23 or the June 23 one. So asked in integration with the dermatology also because it will be causing a swimmer's itch. Then S hematomobium. So terminal spine as you can see here, and to identify it, and it causes squamous cell carcinoma of the bladder. Then S. japanicum, it also causes Katayama fever and eosinophilic diarrhea it causes. तो how to identify this one? तो यहाँ पर देख लेना, एक egg है, एक egg के अंदर और एक egg है, and there is presence of the material in the egg. So these are the three important schistosomiasis egg. Then moving on, Pteromobius vermicularis. So this is a D-shaped egg. So you can appreciate मतलब proper D तो नहीं है, but it looks like a D ऐसे करके. And this causes perianal pruritus in the children. So this one was also a PYQ asked multiple times, and also integration मतलब case करके पूछा गया है ये. And also this appearance you can see here. So this one is called as central tadpole like appearance. इसको बोलते हैं. Then Encytoloma duodenale. So this egg has blastomeres present. These are the blastomeres. Multiple blastomeres are present, जो कि मतलब ऐसे ऐसे appearance देते हैं इसको. And by this you can identify it easily. It enters the sole of the foot and causes ground itch. So this is the important thing which you must remember. Then the Trichis trichiura. So this is a dumbbell shaped. So this one was also a PYQ. तो ये dumbbell की तरह दिखता है and associated with the iron deficiency anemia and rectal prolapse in the children. So these were some important parasites egg which you must remember along with the images. Then moving on to the endocarditis. Frequently questions have been asked on this endocarditis. So I thought क्योंकि ये जो कॉज है दैट वन इज़ मोस्टली कन्फ्यूजिंग, तो बहुत बार कन्फ्यूजन हो जाती है, तो आई थॉट वाई नॉट कवर इट वंस अगेन हियर सो दैट विल बी ईजियर फॉर यू. सो इट कम्स इन इंटीग्रेशन विद द मेडिसिन ऑल्सो. तो मेडिसिन में और भी बहुत सारी चीज़ें विल बी डिस्क्राइबिंग इन दिस इन्फेक्टिव एंडोकार्डाइटिस एंड ऑल्सो द डायग्नोस्टिक क्राइटेरिया जो भी है, यू नीड टू रीड इट कम्प्लीटली फ्रॉम द मेडिसिन. नाउ द मोस्ट कॉमन कॉज ऑफ द acute endocarditis, and in case of a IV drug abuser it is staph aureus. Then in case of prosthetic valve endocarditis it is the staph epidermidis. In case of subacute it will be strep viridans, because these are बहुत बार confusion होता है इस पे, तो इसीलिए you need to remember this. तो and also in the question you need to look at the wordings described कि IV drug abuser है या prosthetic valve है या फिर subacute bacterial, तो all these things. Then moving on to the sterilization method. So general microbiology say this one is also an important topic. So questions are asked on this. So let's look at it. So physical and chemical methods are there. Now in the physical method again classified into the heat and the radiation. तो विल लुक कि पर्टिकुलर में ईच इसमें क्या क्या होता है. तो हीट में देर बी ड्राई एंड अगेन मॉइस्ट, एंड ड्राई में इंसेरिनेशन यूज फॉर द हॉस्पिटल वेस्ट. सो दिस वन इज ऑल्सो आस्क्ड. देन hot air oven. तो hot air oven में it will be kept at 160 degrees Celsius for 2 hours. Sterilized in this are the glassware, syringes, cotton swab and the liquid paraffin. Then moving on to the pasteurization. The pasteurization important, and two methods are there. One is the holder and another one is the flash. The holder में 63 degrees and for 30 minutes. So how to remember it? See, 63 3 से ending होगा इसीलिए 30 then minute. ऐसे करके you can remember it. 36 63 30 63 30 for the holder, and for the flash it will be 72 70 20 72 20. तो 20 seconds है in case of flash. So this one is preferred more nowadays and it is better because it kills the Coxiella bruneti because this is a highly toxic and it needs higher temperature to be killed. तो इसीलिए it will be done by using the flash method. Then autoclave, this is the temperature maintained 121 degrees Celsius for 15 minutes and under the pressure 15 psi. So the instrument of what all we will be using, those, then apron, suture, media and the sputum, all these are sterilized using the autoclave. Then radiation classified into the ionizing and the non-ionizing. So ionizing radiation used to sterilize catguts and the graft, and for the OT we will be using the non-radiation, non-IR radiations. Then moving on to the chemical methods. So various chemicals are used like the alcohol. In the alcohol specific is the isopropyl alcohol, so used to sterilize the thermometer and the stethoscope. Then aldehyde, formaldehyde and the glutaraldehyde. So glutaraldehyde, bronchoscope and the endoscope. So this one was a PYQ that they'll give all the scopes. So see, one thing we will be remembering by this glutaraldehyde, all the scopes are sterilized using this glutaraldehyde except the stethoscope, because stethoscope we will be doing it by the alcohol. So this question can be confusing because हम तो ऐसे remember करते हैं ना scope करके, तो उसमें stethoscope भी दे देते हैं, then confusion होकर हम कोई और आंसर लगा सकते हैं. तो इसीलिए remember that stethoscope alcohol. Rest और जितने भी scopes है that will be coming under the glutaraldehyde. Then 1% sodium hypochlorite, this one is also an important and PYQ. तो most potent है ये and used for the blood spills. तो clinical case have been asked like a female या फिर एक nurse थी या फिर एक intern while collecting the blood by mistake they will spill the blood on the floor. तो which of the following chemical you will be using? Sodium hypochlorite. देन वेरियस कंट्रोल्स. तो जो ये स्टरलाइजेशन टेक्निक्स है ना, उसके लिए वेदर हमारा टेक्निक जो है स्टरलाइजेशन सक्सेसफुल रहा है या नहीं है वो देखने के लिए वी विल बी यूजिंग द कंट्रोल्स. सो फॉर हॉट एयर ओवन द कंट्रोल्स यूज्ड आर द बी सबटिलिस, बी एट्रोफिकस एंड क्लोस्ट्रीडियम टेटनाई. Then for autoclave it is the Beestia thermophilicus, and this one is also used for the plasma sterilization. An important thing to remember that for plasma sterilization we will be using H2O2. तो ये भी PYQ था. Then रेडिएशन के लिए बी प्यूमिलिस, फिल्ट्रेशन के लिए बी डिमिन्यूटा एंड गैस के लिए बी ग्लोबीजी. सो दीज आर द कंट्रोल्स विच यू मस्ट रिमेंबर. देन मूविंग ऑन टू सम अदर बेसिक थिंग्स. सो ये ऐसे रहेंगे दीज बेसिक थिंग्स ना, दिस विल ऑल्सो हेल्प यू टू सॉल्व अ केस इफ एट ऑल दे डिस्क्राइब इन अ केस. मतलब कि आप पूरा केस पढ़ ले, आपको समझ में नहीं आ रहा है, बट एक हिंट रहेगा ना, यू कैन सी अ हिंट एंड यू कैन सी समथिंग दैट, उससे आपको श्योर लग हो जाएगा कि यही उसका आंसर है. तो दिस विल हेल्प यू इन आइडेंटिफाइंग द केस. और एल्स इफ एट ऑल वन लाइनर दे देंगे तो इट विल बी क्वाइट ईजियर, बट वन लाइनर आजकल देते नहीं है, तो क्लिनिकल केसेस ही देते हैं ज़्यादातर. तो ऑर्गेनिज्म एंड द मोटिलिटी. तो स्वार्मिंग मोटिलिटी सीन विद द प्रोटियस एंड द क्लोस्ट्रिडियम टेटनाई, ग्लाइडिंग पी एरियोजिनोसा, डार्टिंग कम्फाइलोबैक्टर एंड विब्रिया कोलेरा, falling leaf giardia, shooting star vibrio, corkscrew T pallidum, and lashing bordetella. So these are the important motility and the organism which you must remember. Then shape of the bacteria. तो Corynebacterium जो है क्लब शेप का रहेगा. लैंसियोलेट निमोकोकाई. लैंसियोलेट निमोकोकाई मतलब वो ऐसे रहेगा, ऐसे करके ऐसे ऐसे कैप्सूल में दो अलग अलग लैंसियोशेट शेप का रहेगा. Half moon or lens shape seen in the meningococci, kidney shaped gonococci, comma shaped, very famous question, मतलब सबको पता ही होगा ये comma shaped vibrio coli. Then dumbstreak appearance tetani. Chinese letter तो हमने we have already discussed this, and also image भी हमने देखा था इसका Clostridium diphtheria का. Then D-shaped Neisseria meningitis. Then the colony appearances, so important colony appearances. This one, drought man, तो this is seen with the strep pneumonia, and this one is important क्योंकि questions बहुत बार पूछे गए, and also image based question have been asked on this. Medusa head, we have already discussed it, seen with the Bacillus anthracis. Prost egg, diphtheria. Then fish of school, so ये भी PYQ था. Hemophilus ducreyi, which is the causative organism of the chancroid, and thumbprint Bordetella pertussis. So these are some basic things which you must remember. तो एक बार में कुछ भी याद नहीं होगा ये, एंड इफ इट ऑल, अब देखो टाइम तो है नहीं इतना ज़्यादा, तो सबकी अभी रिविजन ही चल रही होगी, एंड होपफुली ऑल हैव फिनिश दिस माइक्रो. तो एक बार सबकी ख़त्म हो गई होगी, एंड ऑल्सो रिविजन भी हो गई होगी एक बार में. तो नाउ already I think you all will be knowing these things, but still try to revise the things, keep on revising, and solve the MCQ, solve the previous year questions. And if at all you are not able to remember anything, आपको कुछ चीज़ रहती है जो बार बार भूल रहे हो आप, तो write those things, note it down and stick on your study table, या फिर एक नोटबुक बना लो, उस नोटबुक में लिखते जाओ, and daily remove the time 5 or 10 minutes and do look at those points, because this will be helpful. एंड इफ़ एट ऑल अगर आप ये सब नहीं करेंगे तो फिर वो याद आएगा ही नहीं कभी भी. तो यू नीड टू वर्क ऑन दोज थिंग्स विच यू आर फॉरगेटिंग, एंड जो आता है वो तो आता ही है, बट यू नीड टू कीप ऑन रिवाइजिंग द थिंग्स, बिकॉज भूलने की चांसेस रहती है. तो इफ़ यू डू नॉट रिवाइज द थिंग्स फॉर अ लॉन्गर टाइम, देन चांसेस है कि आप भूल जाओगे. तो इसीलिए बी इन टच विथ ऑल द थिंग्स. डेली मिक्स बैग के क्वेश्चन सॉल्व करना, एटलीस्ट 40 to 50 क्वेश्चन मिक्स बैग के सॉल्व करना, सो दैट जो है आपका दिमाग सारे सब्जेक्ट्स में घूम के आ जाएगा एक बार, एंड यू विल बी रिमेंबरिंग द थिंग्स. So thank you so much guys for watching this video. Like this video, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed, and also join me on the Telegram, where you can find various flashcards, then previous year questions, and everything you need for the FMG. So thank you so much guys. Bye bye.